3 simple exercises, easy to do for straightening of the lumbar spine or flat back syndrome. If your lumbar spine is starting to straighten, you're probably already feeling it. Stubborn low back pain, tightness that won't go away, maybe even sharp pain shooting down your leg. What most people don't realize is that losing the natural lumbar curve can lead to bulges and herniations, and the usual stretches or treatment often make it worse. I've helped hundreds of patients recover from spinal conditions like straightening of the lumbar spine or flat back syndrome without surgery or cookie cutter rehab plans. In this video, I'm going to show you 3 simple exercises you can do at home to relieve pain, improve spinal mobility, and begin to restore the natural lumbar curve. And if you stay until the end, I'm going to explain how these exercises fit into a clinically proven 3-step protocol to help improve and correct a straightened lumbar spine. Now, I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and advanced certifications in chiropractic biophysics. I've seen between 200,000 to 300,000 visits, so I've been around a long time. I specialize in treating chronic problems like chronic low back pain, chronic L4, L5, disc bulge, disc herniations, chronic neuropathy, chronic knee problems, chronic foot problems. And I really enjoy helping people that have failed a lot of other traditional care. All right, so what do I utilize? Well, I utilize a very personalized program with each individual. We use 3 main things. Number 1, specific targeted exercises. Number 2, corrective traction for the ligaments to reshape the spine. And number 3, corrective or mirror image adjustments to help correct the spine close to normal. Now, before I begin this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. So we're going to talk about how to increase the lumbar lordosis when you have a lack of it. Either hypolordosis you might see on an X-ray or MRI report, you might see flat back syndrome. So we need a curve so you can absorb shock. It's very simple. So this would be a normal lordosis. Okay, this is a curvature. The green line is normal. As we go from number 5 to number 1, that's abnormal. So this is normal, this is abnormal. This is starting to get a little straighter. As you can see here, there's no curve at number 2. And then this is actually a kyphotic lumbar spine. That's going to lead to chronic pain, chronic degeneration. That's where the type of problems will be is you're on your feet all day and it's going to be hurting. And it's going to hurt for you to sit. You basically don't absorb shock. So if at the beginning stages you might be able to do physical activities, but down the road you're not going to be able to do, whether it's your work, whether it's hobbies. And before you lose the ability to do physical things, you'll have a sensation of, well, I can get through my day, whether it's my work or my hobby, my golf, my hunting, working out, but the next day I feel really beat up. Eventually, if you don't fix that problem, not only do you feel beat up the next day, you will lose the ability to do it. This is another example of a lordosis. Now, this person's facing this way, and you can see there's a curve here. That is a lordosis. That's normal. This is a loss of lordosis, okay? Lack of curve. Now, this person is facing this way, and you can see this is straight up and down. That will lead to chronic pain and chronic disability over time. So, abnormal's over here, normal's here. I'm going to be showing you exercises that are going to help you. Now remember, exercise is approximately about 30% of the treatment necessary. So there's 3 things that you really need to do to improve your alignment. You're going to need mirror image adjustments that take care of the spine and the nervous system. You're going to need traction. Traction is passive. It's for the ligament system. Ligaments hold you in alignment, and then you're going to need exercise. So adjustments, exercise, and traction. So again, when we lose the curve, we don't absorb shock. The other thing that happens, the back part of the spine, called your facet joints. Without the proper curve, we also create pain in the facet joints. Without the proper curve, we irritate the nerve that goes down your leg. So now you start getting things like sciatica. So back pain starts first, you don't fix it, now we get back and hip or back and buttocks. If you don't fix it, the pain goes further and further. The back of the thigh, if you don't fix it, it keeps going until eventually it goes into your calf or your foot. Let me show you what a facet pain looks like. Now, wherever you see red, that's a sign that you're going to feel pain. So without the proper curve, right here's the facet joint. Right here's the nerve that gets pinched or stretched. So without the proper curve, the facet joints get irritated. So like I said, the exercises are part of the solution, approximately 30%. Adjustments, exercise, and traction. And again, you need everything to truly correct a straightening of the lumbar spine. The technique and protocol I'm talking about is called chiropractic biophysics, or CBP for short. I'm certified in biophysics. There's a international registry. You can find a doctor in your area that's certified in chiropractic biophysics. Chiropractic, or CBP, is backed by over 360 research publications. It's common sense corrective care. That's very simple. The key method in CBP is what we call mirror image. It's the opposite of your alignment. So we do mirror image exercise. We've talked about that. Mirror image adjustments, mirror image traction. We also look at your ergonomics and how we can apply your everyday life into help correcting your spine. And so the bottom line is, if a patient presents with a straight and reverse lumbar spine, we want to do the opposite, which is lumbar extension, which is leaning back. And that's what the exercises are designed to do. That's part one. Now, part two would be the mirror image adjustments. That's where I can use a drop table. It's a table that doesn't twist your spine, doesn't make a noise. I can use an instrument. I can do a variety of different techniques. Number three would be mirror image, what we call traction. And we do lumbar extension traction. I've shown you in the past, and we can perhaps show that in the next video. That's where we reshape the spine and we remodel the ligaments into a normal lumbar lordosis, or a normal curvature. Also, there's a home device called a lumbar de Niro roll, and we use in-office lumbar extension traction. Now, my next two videos, I'm going to dive into deeper part 2 and part 3 of how we correct the spine. So subscribe to my channel, hit the like button, that way you don't miss any of these videos. This is the first exercise we're going to show today, one of 3 of the lumbar extension exercise to improve the curve for a flat back lumbar spine or a straight lumbar spine. The first one we're going to do is we're going to need a support against a wall and a thick band, strong thick band. And we're going to do each exercise 10 reps and hold it about 5 or 10 seconds. Now, what we're going to do is we're going to place this band in 2 different places. One right at the base of your spine where your belt is, and the other a couple inches above. Ideally, this exercise should be prescribed by a corrective chiropractor. And it's based on an x-ray. So you look at your x-ray, and the chiropractor will show you where to put this belt. You're going to create tension, and I recommend a split stance, just in case your band breaks. So that way I can catch myself. I'm going to lean back, hold 5 to 10 seconds. That's 1. That's 2. If I want more tension, go back. That's 3. Now we can switch stance a little bit. That's 4. Now, place the band at a different spot. See how that feels. Try at your belt line. See if that feels good. Create tension, a strong band. Switch legs. Great. I find that way better. Now you can just stand and lean back. But if something happens to the band, you don't have a back leg to catch you. So that's the first exercise in the lumbar extension, using a band with the wall, standing lumbar extension. And this is probably my favorite. All right, so the first lumbar exercise was standing with the band. Now we're gonna go kneeling. This will give you a little bit of lift, a little bit of distraction. For some of you, this may feel really good. Again, anything that causes pain going down your legs, don't do it. If it makes your legs feel numb, don't do it. But for a lot of you, this will give you relief, all right? So we're gonna go kneeling, put a pad underneath your knee, and this is pulling up on an angle, and you're gonna do the same thing. 10 reps, hold 5 seconds. If you want more tension, move back. This is a strong band. Now you're also stretching your hip flexor, so this feels really good to stretch here and then extend back. Again, place the band either around L3, which is about 4 inches above your belt line, or put it down around L5. Again, this is to improve the lumbar curve, to help improve flat back syndrome or a lumbar curve that does not have the proper curve. It's got a decreased curve. You're hypolordotic. So again, I move the band down a little bit lower. Hold it 5 seconds. And then I'm also going to recommend that we always switch legs. And then as I can alternate stretching the hip flexor, feels really good. A lot of people would benefit from this. All right, that's number 2 for increasing lumbar curve. This is exercise number 3 to improve the lumbar curve. We showed standing, we showed kneeling, and this one is sitting. Same concept, lean back, relax, lean back, relax. If you want more tension, you move back. Again, everything should feel good to you. There should be no pain going down the legs. And you're really trying to create a curve, create extension in the spine. And again, you can alternate from belt line to a few inches above or at L3. And really push your stomach forward as you create extension. That's the third exercise in the Increasing Lumbar Lordosis series. If these exercises helped you even just a little bit, do me a favor, all right? Like it and share it, this video. Now, it helps more people struggling with lumbar spine pain. And again, we're trying to create an environment where the body can heal itself. We want to avoid drugs and surgery. So if you help me out here, we're going to help other people that can find relief that they've been searching for. Also, drop a comment below and tell me which one of the exercises felt the best for your back. You know, so there's a variety of ones that I showed. I showed the seating extension with the belt. I showed standing with the belt. And I also showed kneeling where we do lumbar extension. Now, if you got a disc bulge at L4, L5 or L5S1 linked to a straightened lumbar spine, don't stop here. Watch the next video where I rock you through the exact exercise to help you get out of pain and back to moving freely. Right here.